Welcome to our webinar about collaborative care, a nationally recognized program to improve access to behavioral health care and improve patient outcomes. I would like to first introduce our collaborative care team. Mina Bozak, the medical director at Animo Sano Psychiatry. Myself, Jennifer Street, the collaborative care director at Animo Sano Psychiatry, and Ryan Hess, the chief executive officer at Connective. A little bit about us. We are a behavioral healthcare clinic located in Durham, North Carolina. We provide care and treatment for patients with anxiety disorders, depression, PTSD, OCD, sleep disorders, and we specialize in ADHD treatment. We offer different services from inpatient and virtual direct patient care, in addition to collaborative care. Our mission is to be the best-in-class solution for high quality and accessible behavioral health care. The problem is that there's a lack of behavioral health resources in our area, resulting in long wait times, fragmented care, misdiagnosis and treatment, poor care utilization, preventable use of emergency services, missed reimbursements for behavioral health care, value-based contracts not optimized, and provider burnout. Collaborative care at Animo Sano Psychiatry is the solution to improving behavioral health care access and outcomes while reducing costs. So what is collaborative care? It is an evidence-based multi-component intervention design. It allows for integrative care between primary care providers, behavioral health specialists, and patients. It has a patient-centered and team-based approach, proven to be effective in improving patients' behavioral and overall health. A care model that is reimbursable by Medicaid, Medicare, BCBS, and many others. The purpose is to increase access to evidence-based behavioral health treatments, improve patient outcomes, increase patient satisfaction and physician satisfaction, and reduce healthcare costs. This is a general model of the collaborative care model with the patient centered, the primary care treating physician, and the behavioral health care manager who work closely with the patient. There is a very important registry of all patients that are in the collaborative care program, and the psychiatrist who's consulted by the primary care provider and the patient when needed. So why focus on the primary care setting? Primary care setting may serve as the only accessible care for individuals experiencing behavioral health problems. Behavioral health concerns can make up as much as 70% of primary care visits dealing with anxiety, panic, depression, and stress. PCPs play a critical role in the diagnosis, treatment, and management of behavioral health disorders. 45% of patients that commit suicide have seen their primary care provider within that same month. Patients referred to psychiatry often do not make or attend their appointments. Primary care has the connection. Animo Sano Psychiatry has the expertise. Now I'd like to share an illustrated video with you. This is the UK's version of collaborative care. It presents similar features and aspects that our collaborative care program will provide. So I'd like to share that with you now.
It's 5:30 in the afternoon and you've several patients left to see, when in comes Rose. She lives with osteoarthritis, diabetes and COPD. Her notes are long and are filled with missed appointments and overdue tests. Rose's daughter made the appointment because her breathing has been a bit up and down. Her mood seems low, but with only 10 minutes there's little time to find out why, just enough to repeat her prescription, take her blood pressure, and suggest more appointments. She probably won't make these, and there'll be many more consultations like this one as her conditions gradually worsen. Your heart sinks. But it doesn't have to be like this. Rose's life is complex. She's cared for by her daughter, but she also cares for her grandson with behavioural difficulties. Despite her multiple conditions, she is confused by medical jargon. She knows that your prescriptions work in the short term, but with a lot going on, spirometry and blood tests seem theoretical and less important than supporting her daughter and dealing with her grandson's tantrums. There's no medical fix for this. Rose needs support specific to her and her situation. She needs a network around her. But with GPs already at capacity, who can take on this extra work? No one can ask you to care more or work harder than you do already. But as a whole practice, as a team, can we work smarter? Imagine if before seeing you, Rose had already worked with a care planning team embedded in your practice, designed to draw on support from other organisations and the wider community. They work with Rose and the people closest to her, people like her daughter. A team who've gone through the 4 stages of care planning. And so all of this has already taken place. This is a new type of consultation, with time to listen, understand what matters to Rose, and continue to develop her ongoing care plan together. Rather than suffer that sinking feeling, you can clearly see that your work is making a difference. Care planning was created by clinicians who were exhausted and dissatisfied with the status quo. Good doctors lacking the time, space, and backup to be really great doctors. It does take work to switch from a disease focus to a patient-centered care planning system. There will be changes in your organization and to the culture of your practice. A new call and recall system is needed, and training will be required throughout your whole team. But it isn't impossible, and the effort is worth it. There are hundreds of GPs who are doing it already and are willing to help. Every day we can see a world where we do things better. So get involved with collaborative care and support planning now and see the difference for yourself.
Now I'd like to discuss our collaborative care program at Animo Sano Psychiatry, also known as the ASP-CCM. This is an all-in-one service in which Animo Sano Psychiatry will provide all of the components required in a collaborative care program. It's unique with 2 supportive arms, the behavioral health care manager and a digital health solution support tool through Connective Health. Collaborative care is an evidence-based solution proven to increase the access to psychiatric services and improve patient outcomes. It's authentic. It's designed with the primary care practice and the patient in mind. We are a one-stop shop. With a typical collaborative care model, the primary care facility must create and sustain all expectations of the collaborative care model, including the care manager, the psychiatrist, the patient registry, billing, and all patient care. We will do all of this for you. We provide primary care consultations, direct psychiatric care, and collaborative care. Behavioral health care managers are a required component of the collaborative care program. We take on the responsibilities for training and monitoring our managers' performance to ensure your patients are receiving the best-in-class care solution. In our digital health solution, through Connective Health, will provide health summaries for all patients and flag those that may benefit from the ASP-CCM. Partnering with Connective Health will seamlessly connect documentation between all members of the team. I will now turn it over to Ryan Hess to discuss more about Connective Health's digital health solution.
Great. Thank you, Jennifer. As mentioned, my name is Ryan Hess, and I'm the CEO of Connective Health. Connective Health is a service that works within your EHR to really bring collaborative care to life. And the key to our service is that we deliver something into your EHRs that your providers want to look at. So we deliver into your EHRs a 30-second snapshot of the patient from outside your clinic. And then we deliver behavioral health support alongside that. So we'll flag potential patients with conditions, and then we will enable a referral out if that is necessary, highlighting Animo Sano as the collaborative care referral option for behavioral health. Next slide, Jennifer. So we deliver into your EHR is a really streamlined one-page synopsis of your patient. Who else have they seen outside of your office? What was the assessment and plan that those providers made for those patients for those conditions? Inclusive of what did Animo Sano's care plan look like based on their assessment of the patient, and what is their care plan for that patient going forward. So we deliver this the day before the patient arrives into your workflow. And then if there is a behavioral health condition, we will also, as I said, flag that there are referral options with Animo Sano as the coordinated care referral option for behavioral health. Next slide, please. So the workflow will look like this. So in your PCP's office, the day before the patient shows up, we will deliver a care summary. As the provider preps for the patient, they'll go through the care summary. They will have behavioral health insights, so either flagging that a condition might exist, perhaps made by another provider outside of your clinic, or perhaps there is a number of conditions that would suggest that a behavioral health condition does exist but has not been diagnosed yet. In either of those scenarios, we will deliver a list of referral options with Animo Sano listed as the top coordinated care referral option. We will support a warm handoff to Animo Sano. Animo Sano will deliver world-class care and also track the patient over time, and we will bring that care plan and we will bring any updates about that patient back into your primary care provider's workflow. So what your patients get is truly collaborative care, truly better outcomes with no change within your workflow, with no change, no work within your EHR. So I'll hand it back to Jennifer, who's going to talk a little bit more about the big picture.
Thank you, Ryan. Now I'd like to discuss the general workflow of how collaborative care may work in your office. So first, the patient makes their appointment. The patient care summary from Connective Health arrives in your EHR. The patient is seen at the primary care visit. Behavioral health screening is completed. If there's a concern for a behavioral health condition, a warm introduction to the ASP-CCM and referrals take place. A treatment plan is made and initiated, and the PCP and patient have active engagement in the ASP-CCM. So how can this program help patients? By receiving behavioral health treatments sooner with a physician that they already know and trust. Follow-up, education, resources are all provided through an experienced and dedicated behavioral health care manager, resulting in better clinical outcomes. This program provides behavioral health care needs in the primary care setting. It increases access to care, reduces wait times, increases follow-up visits. Patients receive the highest quality of behavioral health care treatments in a timely manner. It reduces healthcare costs and is proven to improve multiple clinical outcomes. How does this program help primary care practices? It tracks and demonstrates improvement in your patient's clinical outcomes. It provides reliable psychiatric expertise and support to all physicians in the practice. It will reduce the number of visits a patient needs to come in for behavioral health problems. It reduces the number of patients needing to be referred to psychiatry for direct patient care. It improves patient health outcomes, improves patient satisfaction and physician satisfaction, reduces physician burnout and turnover, and reduces healthcare costs. So implementing this into the primary care practice. First, we will review your current clinic workflow. The collaborative care director, myself, will review the current clinic workflow with personalized visits. Then we will integrate without disturbing the current process. The team will work together to develop a workflow that will be embedded into your current clinic workflow with minimal changes. Then we will monitor and correct. We will evaluate the established workflows, processes, and clinic satisfaction. Any improvements necessary are made to ensure a smooth experience for all team members and patients. This program is developed with the PCP and the patient in mind. So what are the responsibilities of the primary care provider? To screen all patients for depression and anxiety with the PHQ-9 and GAD-7 screening tools. Refer appropriate patients to the ASP-CCM program. Provide behavioral health treatments and recommendations as discussed amongst the team. Then engage with the behavioral health care manager about active patients. See patients for follow-up care in a timely manner while they're active in the ASP-CCM program. And then build collaborative care codes to the appropriate payers for the patient's time. Most important is to contact Animo Sano Psychiatry for support. Performance measures. These will be completed and tracked by the ASP-CCM director. In the primary care office, we will track the PHQ-9 and GAD-7 screening tools. We will also track positive patients and how many of those are referred to the ASP-CCM, patients that opt out of the program, the number of follow-up appointments for patients that are in the program, and then satisfaction surveys. For the patient, we will track the number of patients enrolled and graduated from the program, the length of time that they are enrolled in the program, compliance and engagement, reduction in their PHQ-9 and their GAD-7 scores, improvement in other pre-existing conditions, medication utilization, and satisfaction surveys. For Animo Sano Psychiatry, we will track the care manager's time with new and follow-up patients, psychiatry time with patients that are enrolled in the program, and the reduction in wait time in direct psychiatric services. So the benefits of this program: investment in this program will lead to a significant return on investment and return on health. Return on investment: decreased medical spending on outpatient psychiatric services, a decrease in emergency room visits and inpatient admissions, potential for a decrease in overall medical expenses for the patient, possible value-based savings reimbursements for payers, Medicaid and Medicare reimbursements, and reimbursements for collaborative care work. A return on health: improved access to behavioral health care, most important. A decreased burden on limited behavioral health care resources. Improved quality of life. Prevents or improves management of chronic health conditions. Decreased disability and absentee from work, and positive impact on social economic growth for our community. So what's the cost of our collaborative care services? Animo Sano Psychiatry will be providing collaborative care services for primary care practices across North Carolina with little to no out-of-pocket expenses with payer reimbursement of the collaborative care codes. The goal of collaborative care is the mission of Animo Sano Psychiatry: to improve access to behavioral health care. With the ASP, CCM, and your partnership, we can meet the needs of our patients and achieve behavioral health peace for our community. Now I'd like to share with you a patient testimonial of how collaborative care can be a success for a patient.
No mom ever looks at that beautiful baby laying in her arms and thinks mental illness.
He was so outgoing and everyone liked him, and he did really well in school, and the teachers always loved him.
We moved to Washington from Oregon when I was 11. And then from there, it just seemed really lonely. It was hard to make friends and just seemed to kind of go down from there.
I kind of noticed things happening around when he was 16. He would get really defiant when we were asking questions and wouldn't really give us direct answers and wouldn't tell us where he was.
I was very guarded, and it seemed that more and more of the anxiety was coming out. I just felt kind of lost, like not really knowing what the problem was, so I didn't really know how to address it. And the worse that got, the more I was self-medicating. Every once in a while it became like every day, and every day became like all day, and then it just became harder and harder to manage, and it just seemed to snowball. And it just got darker and darker, and it was just, it didn't really seem like there was any way out, and I just felt completely buried by it. And then it finally caught up with me.
One Saturday, I was in Portland with a girlfriend buying some school supplies, and I got a phone call from my husband, and he said that Danny hurt himself.
I felt that at one point, if I could push enough people away that I wouldn't have to worry about it, that no one would miss me when I was gone.
So finally I got it out of him that Danny had slit his wrist.
Daniel was referred to Country Doctor, a community health clinic that practices collaborative care. Collaborative care provides mental health care in primary care and other familiar settings where most people already receive their medical care. It's a patient-centered approach that builds on the existing relationship between the patient and primary care provider. Unlike usual care, collaborative care gives mental health care support to primary care providers by adding new members to the care team.
When I see a person in primary care, I have 15 minutes with them. And it's very difficult to make a mental health diagnosis in 15 minutes. It helps to have somebody who has time to really fully assess a person's symptoms and get the correct diagnosis, and then work with a psychiatrist to get the best treatment plan.
That person is the care manager, the third member of the collaborative care team. The care manager manages the overall treatment plan, provides brief psychotherapy proven to work in primary care, supports medication management, and facilitates communication with all members of the team, especially the patient.
Daniel was referred to me through his primary care provider, Angel, and he was having a lot of health concerns, but also experiencing pretty significant anxiety symptoms and ADHD symptoms.
The fourth member of the team, the psychiatric consultant, works closely with the care manager to provide a mental health diagnosis and speaks with a primary care provider or patient as needed. The psychiatric consultant and care manager work together to develop treatment plans, usually over the phone, using a caseload approach.
My role is to be able to know what are the evidence-based treatments that we can use to help patients with depression. So one of the things I can do is have a variety of options for the primary care provider to try when patients don't respond to first-line treatment.
So she would make recommendations, and then my role would be to make sure that those recommendations were relayed to Daniel's primary care provider.
The fact that I could go to a checkup visit to see Angel and have her already know what Annie and I discussed. It was so much easier than me trying to remember with everything else going on, like, oh yeah, what did we talk about last week?
It helps me feel really confident in the diagnosis that is eventually given.
Collaborative care takes a population-based approach to mental health and uses a registry to track clinical outcomes over time of every patient being seen. This shapes the treatment plan and focuses attention on those patients who need the most help.
One of the things that's really unique about collaborative care is because we do that tracking over time, we can actually kind of hold the memory a bit for patients sometimes and help them actually see their progress when they don't see it. So sometimes patients get stuck and they can feel like nothing's getting better because the work of changing is so hard. People can kind of want to give up.
Like sometimes they'll be like, I don't feel any better. It's like, well, 3 months ago, this is where you were. And this is where you're saying you are now. And that comparison is really helpful.
You know, there were times when he wasn't doing that well and he kept coming back anyway and hanging in there with us when we had to try a couple of different medications and try some different behavioral approaches to the things that he was struggling with.
Collaborative care offers a full range of treatment options that have been proven to work in primary care. For Daniel, a combination of psychotherapy and medication helped him get better.
You know, it's easy to try to put a Band-Aid over something, but I feel that if he didn't have the counseling, I don't think he'd be where he is today.
Treatment is a process, and there is still work to do. But since coming to Country Doctor and being a part of a collaborative care team, Daniel has made huge progress. He's doing well in community college and is enrolled in an externship program to become a medical assistant. Long term, he plans to go to medical school to become a doctor. Collaborative care has been proven to be more effective than usual care in over 80 randomized clinical trials. And it achieves the triple aim of healthcare reform: lowering costs, improving clinical outcomes, and increasing patient satisfaction.
It just feels like this huge thing is lifted off of all of us. He's finally become who he was supposed to be all along, and that's the neatest part.
There are many people in our community just like Daniel. They know they need help, but they do not know where to find it, do not have the time to wait for it, and cannot get better without our care. Collaborative care is an evidence-based program proven to be successful in improving patients' health and well-being. We can make a difference together. So we ask you to consider partnering with us in the Collaborative Care Initiative to improve our community. So thank you for your time. If you would like to learn more, we have our website here with the Collaborative Care for Providers linked. And also, if there's any questions, if you're interested in partnering with us, or would just like to learn more, chat more, my email is also here at jennifer@animosano psychiatry.com. Thank you and have a wonderful day.